Welcome. Welcome to rpay.org, also known as forpay.org, which is foremost organization reimbursement premium adjusted yields. Premium adjusted. Basically, it's an account-based healthcare. I've been talking quite a bit on the consumers' health. Consumers' health. Yes. Today we'll talk about what are those big ideas for consumers' health. Let me explain to you one by one, and we'll go and visit each issue and see what you guys think of it. Because I believe consumers have been ignored, especially in regard to the healthcare, because it has always been the consumer. But in 1930s, once the insurance companies have been introduced, it has been an insurer-driven healthcare. Right now, what we have is an insurer-driven healthcare, not consumer-driven, insurer-driven. And insurance companies have no interest in lowering the cost, folks. They have no interest. Whereas consumers are demanding lower costs, and nobody's listening. Government can't solve it. Government has no idea to cut down the cost. You know who has the best, who among the different categories, who is the best to lower the healthcare costs? Is the consumer. If you empower the consumer, I bet you the cost of the healthcare will go down. We have spent $3.7 trillion. Yes. And it has surpassed the national defense budget. Yes. And we ranked 37th in the world in healthcare delivery. How about that? In spite of spending all this money, where are we in healthcare? United States should be number one in healthcare, but it's not. It is not. Unless you empower this to the consumer, we will never get there. I'll go one by one and talk about what are the big ideas for the consumers. Yes, what are the big ideas for the consumers' health? So far, all along, consumers have never been in the driver's seat. It has always been the insurers, and the government want to get involved in healthcare delivery. What a mess it will be, because government cannot lower the costs of the healthcare, and they have no idea how to handle healthcare, because it is complex. It is complex, but I'll try to simplify it, folks, how it can be done. Yes, we are the richest country on the face of the earth, but when it comes to healthcare, we are nowhere near. So-called socialized medicine doesn't work for the United States, because American people will never go for the two-tier system, so-called, who have it, who have not. Maybe England and Canada can tolerate it, but Americans will never tolerate two-tier system, so-called first class and second class. That is not going to happen in the United States. Unless you empower the consumer, we will never get there. We will never get there. So let me elaborate on those big ideas. What are those big ideas? Number one, risk segmentation. Risk segmentation is the concept. We have to be, as far as the concept of insurance is, you share the risk among a broad category of people. But it should be of a similar quality. Like when I say you have a right to be grouped with others with similar health risks, you cannot, you cannot, you have to have a segmentation, folks. Segmentation is what people are healthy. They should belong to the well category. They never see a doctor. They never go to the hospital. Their premiums should be among the well category. People are at risk, like hypertension, diabetes, smokers. They are at risk. They should be grouped together at risk category, and premiums have to be based on at risk. Yes. Chronic illness. This is where our focus should be, on chronic illness. How to lower the cost of the chronic illness category. We have only 15% of the folks with chronic illness, but their claims are almost half, 50%, 48 to 50% of the claims are from the chronic illness. So premium should be based among the chronic illness category. And we can lower the premiums among the chronic illness. Last but not the least is catastrophic. Catastrophic is a limited time, and the premium should be based on the catastrophic exposure of an illness, cancer, like cancer. So risk segmentation is a big idea, folks. Yes. We need to focus on segmenting the risk, and insurance companies have been fighting hard against risk segmentation. Right now, you are paying for everybody else's problems. You are paying for the entire, your risk is shared among the entire 340 million Americans. It can't be that way. Next. What is the next big idea? Is healthcare consumerism, so-called healthcare consumerism. You are a healthcare consumer. Yes, all Americans are. Efficient free market always respond to the consumer demands for products, services, and information. Yes, it is time we tried a system that focuses on the customer and the patient's needs. We haven't tried it, folks. We say we have tried. We have never given empowerment to the consumer and the customer. Customer is the one who demands affordability, competition, and transparency. Right now, the healthcare is going in the wrong direction. They're trying to consolidate. They're trying to take away the competition. Question of affordability. Consumers are not able to afford. There are too many bankruptcies. Folks are getting hurt. Families are declaring bankruptcy because they are not able to pay healthcare bills. Tell me, this is from my personal experience. For being in the hospital less than a day, 23 hours, I received a bill for $227,000. 1 day stay, less than a day. How can you justify the cost of a 1 day stay for $227,000? This is what brought me here today. I'm trying to focus on consumerism, healthcare consumerism. What is the next big idea? It has to be personalized, folks. Personalized healthcare, personalized health insurance, so called. It is a voluntary, hassle free idea that focuses on the importance of health insurance affordability and choice. We are not focusing that. We are not focusing on the health insurance affordability. Everybody's premiums keeps rising, even under the Obamacare. It never lowered the premiums. It keeps rising. And there's no choice. Personalized healthcare means consumer have to have a choice. They can go to any doctor whom they want because they're the one paying for the care. It does not, the mandates don't work. With personalized health insurance, premiums have to be 15 to 20% lower than what we have. Otherwise, we just can't do it, folks. The premiums have to go down by 20% across the board, especially for people with well category. Their premiums have to be a lot lower. At risk also should go down. Then we can focus on people with chronic illness. Yes, we can lower the cost especially with the technology. Yes, telehealth, telemedicine, and you have there are a lot of avenues we can lower the cost. We need to address a personalized approach to the healthcare. It has to be insurance has to be personalized with affordability and choice. What is the next big idea? Individual health insurance. Individual health insurance has to be affordable and it should be a guarantee. Cover all pre-existing conditions and help the sickest among us with the most serious impaired health conditions. This is what the beauty about having individual health insurance. We have to have individual health insurance. It has to be covering pre-existing conditions. And it has to address the sickest. It has to address the sickest among us. How do we provide the care for the sickest among us? Best care, not the mediocre care, not like what we have had through mandates. And we never really address the best care aspect of it because the healthcare has been hijacked, folks. It has been hijacked from the consumer. Okay, what is the next big idea, you may ask? Small group health insurance. Our country, small businesses, this is where it's surprising. So-called uninsured, they belong to a small business as our engine. Our country drives on small businesses. Our main engine and the growth is from small businesses. And people, smaller business employers are not able to afford. They're not able to provide health insurance to their employees. They want to, but they keep raising the minimum wage, but they're not looking at the health insurance point of view. Minimum wage is a gamut because minimum wage doesn't solve the issues, folks. Every time they raise the minimum wage, it all the services costs go up, everything goes up, but it doesn't address. They have not been even talking about health insurance, how a small employer can be grouped together into a larger employer group. And they need to have a segmentation in the smaller group members into impaired health support plan. They should be able to have, if there's a family, one member of the family is impaired, they should be able to segment and provide the insurance for the rest of the folks. The smaller employer groups should be able to get the same benefits as the larger employer group. So as a result, smaller employer groups, so-called mom and pop businesses, should be able to group together and compete with a larger employer group in providing the best health care. We are not doing that, folks. Uh, it will result in lowering the premiums for the smaller employers, and it should be it should go along with the where employers should be able to pride himself in providing insurance for their employees. We're not addressing that. Smaller group health insurance is a big idea, folks. The next one is larger self-insured groups. These are the large self-insured groups. They also need a healthcare reform and health insurance, so-called health insurance reform. Even for the larger self-insured groups, they need is insurance reform. Larger self-insured groups would benefit from transparency of medical service costs, medical quality standards, and we need a tort reform for all the healthcare professionals so they don't have to spend on defensive medicine. The cost keeps rising because healthcare professionals have to defend themselves. They order unnecessary tests. We need to have the tort reform. That is very critical, folks, very critical. And we need to lower the uncompensated care by the hospitals. That's another thing which we need to address. Uncompensated care by the hospitals is costing a nominal leg, and that's one of the reasons why hospitals they keep raising the premiums to remain afloat. So you really need to address that. Minimize the uncompensated care by the hospital. What is the next big idea, folks? I would rather see public-private partnership. Health Review Authority under the umbrella of public-private partnership with a fair segmentation of risk. And the goal of the Health Review Authority is to empower the consumers. So that way, everyone, Health Review Authority goal is to provide health insurance for everyone. If they were denied health insurance, Health Review Authority steps in, provides the certificate of guaranteed coverage under the public-private partnership, where it doesn't cost the government a penny. I think that's the beauty about Health Review Authority. It doesn't cost the government a penny, folks. So we need to really address. Ron Bachman, the actuarial who has come up with these ideas, I commend him because he's the one who started this Medicare supplemental insurance. You all know that. He's the same gentleman from Texas. He's proposing these big ideas. We need to listen to his. And I would like you to read his book, Unlocking the Secrets of Health Insurance Premium. I would like everybody to read that. And I hope our representatives in Washington, all of them should be reading that book and see how we can improve the healthcare delivery under the Health Review Authority. What is the next big idea? Obviously, access to care. By creating a better access to affordable health insurance. We are not doing that, folks. Affordable health insurance, if it's affordable, the insurance is a must. but it has to be affordable for all Americans. What is the next big idea? Quality of care. Obviously, we have to focus on quality of care. It's possible, folks, when options to access of care is provided through affordable health insurance. It is possible we can get the best quality of care. The next one in line is cost of care. This is where my main focus is cost, how we can lower the cost with segmentation by health status, group impacts, personal impacts to costs. Group and personal changes in behaviors can lower the use of medical services, lower the cost of the care, reduce premiums, and offset out of pocket costs. Yes, that is very important, folks. What is the next big idea? Financing. How do we finance health insurance? The beauty about financing the health insurance is by three mechanisms, folks. First of all, insurance premiums, number one. And number two, savings. It has to be taxable and non-taxable, like health savings accounts, health reimbursement accounts by the employers like HSAs and HRS. This is where the consumers are empowered by having savings, health savings accounts. And number three, incentives and rewards. In any industry, any sector, once you incentivize the consumers and customers, they will be rewarded for their good behavior, folks. You know, incentives and rewards is the key element for the consumer driven healthcare. That's where the cost will go down once you incentivize the consumer. Yes, it's a must. You have to have. I will be talking more about incentives and rewards in a separate chapter, but those are very important. What's the next big idea? Is individual certificate of guaranteed coverage. This is where we are lacking. Individual certificate of guaranteed coverage, which empowers and guarantees everyone individual health insurance, even if they have a pre-existing conditions, even if they have a pre-existing or in need of a financial assistance. It doesn't matter what their economic status is. That should not be the criteria, but they should have a certificate of guaranteed coverage, even if they have and if they're impaired economically or physically. Segmenting the uninsurable individuals, segmenting the uninsured individuals to the premium subsidized impaired health support plans can lower the premiums for others by 15 to 20%, folks. Yes, 15 to 20%. We need to look into that, folks. So, what is the next big idea? Smaller group certificate of guaranteed coverage for small businesses. This is where we have not addressed how do we make small businesses pay for their employees' health coverage. Using certificate of guaranteed coverage for smaller groups along with impaired health support, impaired health segmentation at application and at first renewal can lower the group premiums by 15 to 20%, folks. 15 to 20%. What's the next big one? Impaired health support plans, folks. Impaired health support plans. Enactment of impaired health support plans will provide maximum help and support to those most in need. Yes, most in need. Every beneficial service, assistance, and plan design options will be available to those with chronic and persistent illnesses. They should be prioritized. What is the next big one? Eligibility of impaired health support plans. Providing eligibility to both uninsurable individuals and small group members will provide target support and choice of plan options and affordable health insurance for the sickest among us. Yes, for the sickest among us. The next big one is options for impaired health support plans. What are the options, folks? Impaired health support plans with insurance plan options related to their unique needs. This is where the subsidy, so-called federal and state subsidies play. But these are only for 2 to 3% of the population, folks. We are not talking about people with chronic illnesses. The impaired health, really impaired group are only 2 to 3% of the entire population. You mean to say our government cannot take care of the impaired health support plans through federal and state so-called subsidies? The next big idea is insurance companies, participating insurers. Insurance companies who voluntarily participate with Health Review Authority and accept certificates of guaranteed coverage will have a large market share and pricing advantages for both individual and smaller group policies. See, they can compete better and they can lower the premiums, especially for the individual and smaller group policies. So participating insurers should be, we will have to provide all the tools, and under the Health Review Authority, they will have a large market share. Well, we have been talking about, so many people we are uninsured. That's the next big idea we need to address that. How do we address people who voluntarily don't buy insurance? So there is a cost, folks. There's a cost for this. Is a big idea. People, when they don't buy health insurance voluntarily, for whatever the reason, there are consequences. This is a big idea, folks. Loss of federal and personal state deductions. When people don't buy insurance, they will not be able to deduct the exemptions, so-called federal and state tax deductions. They will lose the deductions. So as a result, if a person is not insured, when they lose the exemption, federal and state governments will be collecting more funds from these individuals. So people, when they don't buy insurance, health insurance, if they're voluntary and insured, there are consequences. You lose the exemptions, and federal and state government can enforce that and collect more revenue. That revenue should go toward the federal and state impaired health support plans, because we are collecting more revenue on one side. So that should be able to manage impaired health support plans. The last and but not the least, funding the Health Review Authority and impaired health support. This is where the focus should be. How do we fund Health Review Authority and impaired health support plans? Health Review Authority should operate as a self-sufficient entity. It should be free from the Department of Health and Human Services, deriving operating funds, multiple membership and processing fee. They should have a fee for participating insurers and participating members. There is a fee involved for the Health Review Authority to operate. So it is self-funded, folks. It is self-funded. The impaired health support plans, claims, especially the claims, will be supported by commissions, tax deductions, loss, when you lose the deduction losses, and charity donation coupled with state and federal subsidies. So impaired health support plans will be supported by commissions, tax deduction losses, and charity donations coupled with federal and state subsidies. Folks, thank you for listening. If you do like this channel, subscribe to Consumers Doctor. This is Consumers Doctor Bengala. Make some comments. I love you guys. If you can help me facilitate setting up so-called consumer-driven healthcare through rpay.org, which is a nonprofit, folks. It's a nonprofit under the Foremost Organization umbrella. And we want to provide the support who need the most, especially for the impaired health support plans. Thank you for listening. We will see you in the next episode. Goodbye, God bless, and salute.